I'm Dr. Bageorgou from Athens, Greece. I'm the current president of the International Peeling Society. And I'm going to talk to you about PB serum, which is practically enzymes. And from what I know, it's something that it's new in your country. So how many of you are already familiar with enzymes? Good, good. But we have to be more active. So it is a totally new product. These are my disclosures, nothing relevant to this presentation. I wrote some books. So this is a new product. And when it came to my hands, like 3 or 4 years ago, because I did the launching for Greece and I did all the clinical studies, it was a little bit weird. You know, it wasn't like a big company like Allergan, Ipsen, Galderma. It was something new. So being a very active doctor, I was very concerned about the safety and about the results, because when you're talking with colleagues, you have to be honest. So I have to tell you that I'm not doctor of the company, so I'm not talking from the company, but I'm talking from my own experience with the product in my clinic, in real patients that come to our offices and pay for that. So if the patient pays for that, he wants results. I don't know here, but you know, in Greece, they are very demanding. So we have to give them options that make them happy. Happy patient, happy doctor. So this was something very new. So I asked, is it anywhere else, or is it something that you just brought in Greece to make it traditional? So they told me we are already around 50 countries. So it's stuck a little bit. I will go from here. It's the same. Okay. So I've been to their departments and I saw that they're doing a really good job. It's nothing that's just manufactured somewhere in Spain and we don't know anything about that. So practically we're talking about enzymes. And as we're all doctors here, we know that we have certain enzymes coming from animals, from bacteria, and then we have the recombined enzymes. And why we are more into the recombined enzymes? Because they are highly purified, they are high in productivity, and most of them, they are maybe the only ones that can apply in medical conditions. And how does this work? In my country, we have 3 concentrations. I don't know what you have here. So we have low, medium, and high. And practically, all the 3 products contain the same ingredients in different concentrations. So all of the boxes have the same things inside, but in different concentrations. The high, first of all, they contain collagenase, which is an enzyme, lipase, which is another enzyme, and liase, which is another enzyme. And each one of them is doing a certain job. In order to put them together, we need a vehicle, we need a means. And this means is the hyaluronic acid, which is non-cross-linked. Non-cross-linked. What does this mean? 0 vascular complications. So you are free to modify your technique and not be afraid, as our colleague was before, that maybe this product can cause us several problems. Of course, there are some, but they are so minor that we don't care. So why do we need the hyaluronic acid there? Because we need a means to dilute these enzymes. We need something to regulate the inflammation, the fibrosis, and of course, regenerative activities. So this is a non-cross-linked, like a mesotherapy product, but of very high quality, high concentration, very non-cross-linked. And why don't we use enzymes one by one? Why we need all the 3 of them? We need the 3 of them because they studied, and we studied for you, that they work better together. They are a dream team. Their results are more optimal than if we use collagenase on its own or just lipase. There are several products, or just liase. So the combination, the synergy, is what makes this product unique. There are several products on the market that have collagenase, and collagenase is not something new. It's a very high safety profile drug, because we know it for treating Dupuytren's disease, and we know that's a safe product. Some years ago, there was Quo. Quo QWO, was a product, was launched at the States. And when I'm talking about this product during IMCAS or MWC or the American Academy, especially when I lecture for the American Academy of Dermatology, there are several doctors that are raising safety issues because that product at the States was banned. Completely different story. This product has nothing to do with the complications. The other product, I don't know what's happening. Maybe it was not the collagenase, but all the dilutants. They had some issues. FDA banned it, but this is a very safe product. I've injected tons. The 50 countries are injecting tons. So if you meet somebody from the States and raises any concern, be sure that you're talking for a product that is a completely different story with Quo. So we have enzymes, recombined enzymes, and we try to work the best for us and for certain indications for our patients. So there are main factors that affect enzyme activity, and this is the pH. The company has taken care of that. Temperature effect, so it's a kind of injection. You do not rub, you do not apply ice, you do nothing, you do not distract the enzymes. You just inject them and let them do the job. And of course, the substrate concentration effect, which is something I will explain you later. The reconstitution is simple, and we have a live demo, and I will show you one of the best indications that will make your patients really happy. It will take like 5 minutes to make a patient happy. It's very easy. In the box, you have 3 things. You have the enzymes, you have the hyaluronic acid, you will mix it. My PA, Vicky, is here, and she's going to help us with that. It's very easy. You mix it, then according to the indication you are treating, you choose the amount of the dilutant you're going to add, and then you just add a little bit of lidocaine to make the injection more comfortable. So how many times you need to do it? So in Greece, a major concern of the doctor is that the product is expensive. In my hands, it's not expensive. It's not cheap. You know, I'm coming from Greece. Greece is a poor country with rich people. I don't know how the story goes here. So we buy it in our hands. This product costs more than 1 ml of hyaluronic acid, for example. But let's say we're treating cellulitis, okay? What did we have so far? We had mesotherapy products. We asked the patient to come every other week, every 10 days, every 15 days, to do a session of 10 or 15 or 20 or whatever. So in my hands, time is money. So what if you have fully booked offices, okay? You are very active. Imagine somebody will tell you you will treat the same condition and you have to visit your doctor only 3 times. Take your car, make space on your everyday schedule, pay the parking, okay? So time is money. So if somebody tells me you're going to come just 3 times, you have the same or, of course, better result, then this is for me cheaper. And actually it's cheaper because if you do the maths, you will see that 3 or 4 sessions are much cheaper than 8 or 10 or 15 sessions of classic mesotherapy. And of course, the results are much more better. So if we use it with devices, we can combine them. If it's somebody that's traveling, there are patients that are traveling to meet me in Greece, so they want to do everything at the same time. In that case, we do the device, we let the skin attain the temperature, the regular temperature, and then we proceed with enzymes. For example, we cannot do like morphios, like heating devices, radio frequency, and then inject the enzymes. They will be destroyed. So either the patient waits there until the skin comes back to the normal temperature, or we can tell him, if you want, you can come another day or in between the sessions, if you need it. There are some patients that need them. So why collagenase? Because it has anti-fibrotic effects. You can see here the fibrosis. And you can see here the effect that gives to the skin. So imagine when we're treating cellulitis, these dimples that the skin has, and unfortunately there's no woman, even with the celebrity ones, that doesn't have cellulitis, thank God. So imagine that we're doing a chemical subcision. This is what I call a chemical subcision, because usually either we treat the whole area or we go with the scalpel and we try to do this subcision in order to free these dimples. Now we go with the needle perpendicular and we do a chemical subcision. So all these dimples are coming up, they're free. So then we have other issues like let's say skin tightness that the lipase is going to take care of. Second enzyme, lipase, because we know from the pathology of cellulitis that we have a mixed problem, a little bit of sagging, a little bit of circulation problems, a little bit of fatty issues. So this is why we are doing this algorithm to try to manage all the three ways that cause us problems. And then we have lipase. Lipase is an enzyme, to be honest, I've never heard of that before. What it's doing is responsible for degradation of the polysaccharides, which is responsible for the liquid retention in the extracellular matrix. It promotes the drainage, which is very important. It helps the other enzymes work better. And of course, is doing what we call the collagen remodeling of the skin. And this is what we're doing pretty much. This is what is in Europe and and I didn't ask your distributor if you have all of them, but we have different kind of, we have the low, the medium, and the high box for different indications, and we're still evolving. And you know, everything has a protocol, but I never follow protocols. I feel that the protocols are there for us to destroy them. So I will show you what we do. But as we do with injectables, before we touch a patient, we're sure that we have hyaluronidase in the cupboard. And hyaluronidase is one enzyme that we're very familiar with it. Of course, we don't want to deal with it a lot, but it's something that we already know. So there are some potential side effects, but they're so minor that I've injected, I tell you, tons. And I've never seen anything apart from a slight erythema. The only thing you have to ask them if they have allergy on bee bites. If they have an allergy on bee bites, it seems that they are very allergic on enzymes, and this can cause you a very urgent, let's say, allergy or angioedema. But if the patient is not allergic, then you can move on. Contraindication, of course, pregnancy and lactation. We don't have data, this is why. Of course, in case of any dermatopathy or active infections. And we just keep people with autoimmune disease. Of course, autoimmune disease for us is not, for example, thyroiditis, because half Greece, you know, we're by the sea, maybe here also, have issues with the thyroid. But if we have issues with like lupus, we can avoid this. Post-treatment recommendation, just the heat, and of course, blood thinners in order to avoid bruise, not something really important. So, let's say that we want to treat the jaw. You know, there's a trend around the world now. They're removing the buccal fat. This is disastrous for the face, because we do it now that the patient is like around 30 or 40, and then with this, when this patient becomes 50 or 60, everything will be like, you know, a sagging face. And you know how much of effort and money takes to fill a face. And when you remove the lower support of the face, nothing can happen. So instead, we can treat these minor abnormalities we may have, not actually by eliminating all the fat in the area, but treating it with a double approach, a little bit of lipolysis, a little bit of tightening. So you will see that the protocol, you don't need to memorize the protocol, because the protocol comes with the product and you can have it right in front of you when you inject. But you can see these nice results. You can see here, you can see a patient of mine. This is a patient from clinical study. She has been injected with more than 60 mLs of enzymes. This is the proof that nothing can happen to you with enzymes. You can see here this sagging area, and you can see there how nicely it worked. This is a patient. I managed to break a TSK cannula, and I told TSK, this is how you can break your cannulas because they're so nice. But I broke a TSK cannula while trying to fill her face because she has a history of acne scarring, and you will see later in a video I have for you how nicely the enzymes worked for her. So she was injected for all the indications, cellulitis, everything, almost everything. This is what we're going to do in a while to the patient that is going to be preferred by my PA now. So, double chin. You can tell me that we have a lot of products that are doing lipolysis. Yes, but we don't have products that do tightening at the same time. And this is very important because, okay, you can remove the volume, but what's going to happen with the skin? So here, we're not doing an aggressive lipolysis, but we're doing a lipolysis to the extent that the patient needs it, and Liaise is doing all the tightening. So this is very important. Low-tech technique, you don't need to remember any parameters. Perpendicular, 1 ml, 1 ml, 1 ml, 1 ml, 1 ml, 1 ml. And what you do is you inject perpendicular with the retrograde technique. If it's very complicated for you, you inject deep with a 30 millimeter needle. I will show you. And then what you do, you inject a little bit more superficial, a little bit more superficial. Even if you're very superficial, it will never give you atrophy, this product. I will tell you what can be your trouble, but it's a completely safe protocol. And this is what we're going to do to our patient here. Again, here you can see some nice results. Very nice results. You can see here, amazing. Look at the tightening, because for the lipolysis is something you can do it. But the tightening of the skin in these kind of patients that are not like 25 years old is something that, you know, in my hands it's a little bit difficult. You need devices to do it. And another hot selling indication in my office is this one. Even if you are very, let's say, thin, sometimes we have a little bit of loose skin and a little bit of fat here that is very difficult to eliminate. So if you inject this product, you can have very nice results, really nice results, a little bit of tightening so that the bras are not so rude with us. Again, the protocol is like that, day 0, 15 days later, and 30 days later. And this is kind of sharp. If it's 16 or 17, it's okay, but it's not a product that you have to inject once per month. So, cellulitis. We have two types of cellulitis. We have the fibrotic cellulitis, women that come that have 1, 2, 3, 4 dimples. And then we have this diffuse cellulitis. And what will make your patients really happy is the over-the-knee area. All these mix of a little bit of sagging, a little bit of fat, with the medium, the product we're going to use for double chin, it will give you great results. 3 sessions, the patient will be really happy. So, what do we know about cellulitis? We know that we have major factors we have to treat. We have the alteration of the microcirculation, the tissue drainage, and of course, we have all these fibrotic septa issues that lead to cellulitis. And this is why I told you before that by the synergy of these enzymes, we treat the whole area. And we go here at this level, and we're doing a chemical subcision. Then, the rest of the enzymes are working in the fat, and the Liaise is doing the last job, is treating the tightness, so the sagging of the skin. It gives the final nice effect to our patient. So, This is my dear friend Doris Hexel. Doris Hexel is a brilliant dermatologist from Brazil. Is a kind friend of mine. She's devoted her life to cellulitis, and if you want to find a nice scale, she's always exceeding her limits. Every year she's publishing another scale. So this is Doris Hexel's scale. It's very nice in order to prove your results to your patients. It's photo arithmetic, which means that you count the dimples, and also you take photos. So this photonumeric algorithm will show your patient the results. You count the dimples because we do not we don't like promise ourselves that the patient will come in the office with cellulitis all over the lower body area, and then she will leave the office like Gigi Hadid. We're honest with our patients, but we have to find an algorithm to communicate with them our results. So whatever the improvement is, we have to prove it to our patients because the patient is paying. So here you can see nice results. Here is a patient. Here is the patient with the face I show you. So this was a nightmare because it was the first patient I treated. And actually, and I should have placed the photo here, after the second visit, she was terrible. So I called my distributor and I told him, now she's worse. So he told me, look, it's a new product. I don't really know what's going on with that, but inject her. Since she's getting worse, re-inject her. So she was really worse during the second treatment, 15 days post the first injection. But during the third and the fourth, she was amazing. This is a 65-year-old lady. She's not a young one. This is a young one. You can see the dimples. We treated her with just, I think this is 1 or 2 sessions. And you see a very happy patient. Scars. This is a really great story because with this product in Colombia, they're treating all these women that were attacked with acids. You know, this is a terrible story, and they have many incidents there. We're treating different kind of scars. So post-surgical scars, keloids, anything. So here you can see the improvement of the scar. Here again, you can see this is a patient of mine. She was a lawyer. She fell off the stairs. My girls in the office call her the nice lady with the high heels. So you can see that she was really pissed when she obtained this ugly scar. We injected her with PB serum, and this is just 1 session. And you can tell me, for example, I can do this with triamcinolone. Why pay for PB serum? And you are right. We can have similar results with triamcinolone. But here, you cannot have similar results with triamcinolone. And here, even more. So here, look at this lady. Look how thick the skin is. This is how I managed to break the TSK cannula, because I was trying to get into with the cannula, to do the subcision and then inject it with some hair, with something, and I couldn't. And I decided to inject her with PB serum. So look at her, 1 session later. All the fibrosis is gone, and then I managed to feel her, and now she's really happy. So this is something you couldn't do with triamcinolone, because on the face, you will get atrophy. For the keloid, yes, I totally agree, and I want to be honest with you. I'm not selling anything. Monday morning, I will be in my office trying to make my money. But here is something that really, this patient could pay millions for PB serum. So scars, acne scars. This is a technique we're still working on. It needs very superficial injection. I had 1 case with atrophy on the skin because I was going deep. So now we know, so the kind of atrophy you can have with PB serum is transient. It's like the atrophy that you can have from hyaluronidase. It's a transient effect, and it's self-treated. Of course, I treated her, not this lady, the other lady that had the complication with hyaluronic acid for free, of course, but now she doesn't need it anymore because the skin has retained all the collagen. But still, she was unhappy for a period of time. So this is why I tell you, when you treat this kind of scars, you go with a 4 millimeter needle, 4 millimeter. The company says 13 millimeters. No, You go with a 4mm needle into the scar, you break the bottom of the scar, and you have great results. Post-surgical fibrosis, you know, plastic surgeons sometimes, they're removing everything, but they have post-surgical fibrosis. The product works miracle, and now, from what I know from my fellow doctors, the plastic surgeons, they inject the PB serum at the same time. Before they do the stitching, they put the PB serum to float underneath the skin. So they find it very useful to avoid any kind of fibrosis. I don't do it, but you can ask maybe your plastic surgeons, and they can confirm that. You see, nice result, but the fibrosis, the skin, you know, is very aggressive sometimes. So more or less, this is what you take home. It's one product, it's a new product, it's a safe product, zero complications, zero. The worst that can happen to you is a little bit of erythema, like the skin is boiling for 1 or 2 days. You can tell it in advance. You maybe have something, so that they are prepared. The case of allergy. So ask them if they're allergic to bees bites. Has any bee ever bitten you? So if they're okay with that, they will be okay with the treatment. So it's the only product available in the world that's doing this thing. It's very easy, and we have multiple indications. Cellulitis, whatever is fibrotic, you can use it. Cellulitis, double chin, wherever you have a little bit of fat. Over the knee area, do not forget it, it will work miracles for you. And of course, now we're going to treat the double chin. If you have any questions, you can stay connected, you can follow us on social media. And of course, if you have any patient you want to treat, you can send me a picture. I'm always 24/7 on my emails, so you can send me whatever you want, and I will tell you exactly what you want to inject. If you have a complication, I wish you good luck, and I'm going to get prepared for our patient who's waiting for us. So thank you so much. Thank you.